Hello, everyone. Hello, Dr. Adetula. Good evening.
Hi, Dr. Ala. How you doing?
Very well, thank you.
It's
It's a
really
pleasure
been
to
a
have you on.
yeah, thank you so much. My pleasure.
Yeah, so good evening, everybody. I'm sure we have a number of participants already on the call. I am Dr. Oluwapelumi Ala, your host for this evening, and we have with us Dr. David Adetula, who is our guest speaker, and he will be talking to us on strengthening Nigeria's response to Lassa Fever. So, before we start, I want to ascertain that I'm audible. Can you all hear me? Okay,
Loud and
Dr.
clear.
Adetula. Okay, thank you very much. So I want to believe other members of the audience can hear me as well. So before we start this webinar this evening, I'll be sharing with a very short presentation about HealthFacts Nigeria, the organization that has brought this program together. It is going to be a very short presentation, and I crave your attention for the next few minutes. So give me a second to share my slides. So I'd like to confirm that you can see my screen.
Yes,
All
we
right.
can
So
see your screen, Dr. Ala.
thank you very much. So good evening, everyone. I'm Ola Kolimi Ala, and I'll be sharing a very short presentation on HealthFacts Nigeria. HealthFacts Nigeria is an online media company that provides health and wellness information for Nigerians and Africans. We cover topics across diseases, lifestyle, nutrition, research, news, and more. Our aim is to empower people with accurate and relevant health information to make informed decisions about their health and well-being. Our mission is very simple, and it is to address health-related problems by providing accurate health and wellness information in the simplest form possible. How do we do this? There are a number of methods that we employ, one of which is blog posts. If you visit our website, www.healthfacts.ng, you'll find a number of blog posts that cover articles, news, updates, and health-related quizzes. We also share infographics and videos across our social media pages. Um, Periodically, we release the newsletter that will tag health alerts. It will update you on trending health information and highlights. Another way we empower the public with um, good health information is by HF Live, an event that we are hosting this evening, where we invite health professionals to speak on chosen topics. This evening, we'll be talking about Lassa Fever. We also organize medical outreaches to local communities, and we have a special video service that you can enjoy for your health needs. So I've spoken about the blog post that you can find at www.healthfacts.ng, and then infographics are available across our social media pages, and you'll find videos that would educate you as well. Health alerts are released periodically via newsletter, via emails, and our social media pages as well. They will enlighten you on relevant health information and new trends. Health Facts Live, we have one this evening. We've invited professionals in times past, and today we have with us Dr. David Adetula. He is ready to enlighten us on the topic strengthening Nigeria's response to Lassa fever. We host medical outreaches to underserved communities. We've hosted in many local communities in Ibadan, and we hope to expand beyond the shores of Ibadan in coming months to years. Um, Beneficiaries have include local people from underserved population. They've enjoyed free health talk, free consultations, free medications, and medical checkup. So, especially, I'd like to bring to your attention the Health Facts video service. It's an expertly curated, evidence-based content series that is based on 6 essential health categories. First is diet and fitness, then diabetes care, hypertension care, skin health, sexual health, and general health tips. So you can benefit from this by subscribing via portal.healthfacts.ng. It It's a very straightforward process, and I'm sure you enjoy what you find there. So thank you very much for your attention this evening. And we're just starting. So very shortly now, we'll be going ahead to listen to Dr. Adetula's presentation on strengthening Nigeria's response to Lassa Fever. So in under minutes, I'll be sharing his own slide. So can you see my screen?
I cannot see your screen yet.
Okay, let's try that again. How about now?
Not yet from my hand,
Okay.
but I really hope it's isn't a problem from my own network signal. So if someone else could confirm if it isn't just from my own end. Okay,
All right.
so I think it's just came up now.
Okay.
But you stopped sharing.
Okay, let's just. I think it's an issue with the browser. So you should be able to see that.
Perfectly.
Oh, the appears putting on slideshow would remove it. So
Oh, really?
we
We
have
had it. Okay. I think it came on slideshow like shortly before now.
okay. I think we can just go
Uh,
ahead with this, right?
okay, that's fine. While you figure it out.
Yeah.
So I should start, right, Dr.
Yes. Yes, please, you can go ahead. Thank you very much.
All right. Thank you very much, Dr. Allah. And then I want to say thank you for inviting me. And I must say, it has been a lot of reminder. I mean, blessing gets, reminding me not to forget about the program. And of course, you also send me my slide. I'm sorry, it came a little later than I would have also loved to, send it in. But really, I'm really excited to be here with every one of you to discuss how we can strengthen, response to Lassa fever in Nigeria. I mean, we're at a time of our national life when there's a whole lot going on regarding Lassa fever, and of course, the infection isn't just sparing anyone, including, doctors and other health workers. So I'm hopeful that after this session, it would raise our index of suspicion as healthcare workers, and of course, we're able to create better awareness on where exactly we want the government to do better. So I am David Adetula. Please, next slide. Okay. I'm a dental surgeon and a public health researcher, and my interests span health policy and health management, and of course systems. And I actually lead a startup called Health Dialogue, where we try to bridge the gap between policies and those who actually need those policies. I mean, people at the grassroots. So, and of course, we address those gaps. And not just in Nigeria, our scope is across the entire length and breadth of Africa. And of course, I currently also serve as the chair of the student training leadership group of the American Committee on Clinical Tropical Medicine and Travelers Health. So that's a subgroup under the American Society of Tropical Medicine and Hygiene. Yes, so I'm actually very excited to be here. Right, I understand my time is very short, and I will try as much as possible to move as fast as I can. But of course, more importantly, I would want us all to take away some very key points that would be very helpful and that would empower us to do better as healthcare workers. Next slide, please. Okay, so I'm just going to create a scenario for us, and I want you to follow me very carefully. As much as possible, this class will be very interactive. I will try to be as interactive as possible. So please, when I request that you engage me, please help this presentation by engaging me. So this is a familiar story. I'm sure many of us would have heard, would have seen this happen, especially if we are at the forefront of responding to, infections, and of course, not just Lassa fever, but even during COVID-19, we saw things like this happen. So imagine a 32-year-old pregnant woman who is living in a rural community in Ondo State, and she develops, fever and weakness. Like many Nigerians, she thought she was dealing with malaria. So she went to what we call the chemists, right? She got anti-malarials and she took them. But a few days later, she became very weak and she started to vomit. And of course, her family figured out that it might be more than malaria. So they took her to a nearby hospital. The clinic treated her again for malaria and typhoid. It's a common thing in our environment here. They tell you it's typhoid, and but our situation didn't improve. And then a week later, she was referred to a teaching hospital, and by then she was, of course, critically ill. At that time, there were a lot of laboratory tests done. Please, next slide, Dr. Ola. All right, thank you. So some laboratory tests were done, and those laboratory tests did confirm that what we might be dealing with here could be, Lassa fever. But at that point, when Lassa fever was already confirmed, despite treatments, unfortunately, we lost her. It didn't just stop at this. Her husband also became infected, right? And of course, two nurses who were at the forefront of caring for her also got infected. And, unfortunately, the number of people who fell to this illness included everyone who were on a path to seeking care. So, thinking about this, I'm sure it's something you all would have at one point in time heard about or would have imagined as a common reality whenever we are dealing with infectious disease, especially Lassa fever. So I want to ask, what do you think are the issues there? I mean, as health workers, I want to believe on this call we have doctors, we have at least those who are interested in healthcare work. So what would you say are the issues there? What would you say are the issues there? Just takes like a minute or 30 seconds to reflect on what could have been the issues there. Now, we can see, thank you very much. You can move to the next slide. There are delayed suspicion. The test was delayed. Of course, diagnosis was delayed. We had thought that we're dealing with malaria or worst case, what we call typhoid. But of course, it wasn't the case. And unfortunately, even when the patient came into the clinic, which could have been a primary care center, we could still not spot that what this woman was dealing with, perhaps even after giving some history that could naturally or should have given off what she was dealing with, we still couldn't pick that it was Lassa fever she was dealing with, right? Until much later. And perhaps everyone in the environment living around her could not even like understand what her case is. Perhaps there's someone even in our community thinking that our village people were after her because she's pregnant. Perhaps she's the first born in their family, and they are taught that, oh, they don't want her to give birth. I mean, these are the realities we face with every day, right? So the health workers too were at risk ultimately, and they had to grapple with a lot of challenges. So if I may ask, at what point do you think these deaths could have been prevented? I mean, can I just have like a guess or two guesses? At what point do you think would have been the fastest way to have nipped this possibility in the bud before it became widespread and before we lost the patient? Anyone, please, in the chat, you could just unmute and I want us to interact. Anyone in the chat? I mean, I always love it when we are very interactive. I'm going to just call names. Dr. Al, am I permitted to call names in the chat, on the participant list?
Yes, please, you can go ahead, sir.
All right, thank you
Okay,
very
I
much.
think
Okay,
we have.
Dr. Al, please go ahead.
No, I said we have a volunteer. I saw Mary from Laya Oni raise her hand.
All right, Mary, can we have you, please?
All right. Hello, everyone. Good evening. Thank you so much, Dr. Adetula, for such a very important topic in our day. So for the issue, for me, I think I would start from a very maybe nuanced aspect, which is one of the things I'm saying now is the importance of how the people that live right, with the woman, maybe even family member, right? It's something that once a family member have an idea or they are able to manage a symptom or they're able to identify a symptom, they're able to help the woman or anybody in that situation to get the necessary help. And I think that is why it's important for everybody to get informed, right, about what Lassa fever is, the symptoms. So the best place or the first point of contact for help is the family member, the immediate family, the people living around. It's easier that way to be able to refer such persons, once we identify a symptom, as well as very, very prominent primary healthcare center. I mean, it's one thing to have identified the symptom, it's another thing for a primary health center close home, right, to be able to have what it takes to address the issue such that it doesn't even affect the healthcare practitioners involved. So I would say a strengthened primary healthcare and a well-informed family members.
Right. Thank you very, very much, Mary. Mary has done, I mean, perhaps we are done with what I've come here to do today because it was quite elaborate. Thank you so much, Mary. And of course, you did justice to what, I mean, could have been where we could have gotten it right. So you made mention of something that if the family members had the right awareness, they would have probably spotted at that point when the patient developed some symptoms that were related to malaria, but it was prolonged even after using anti-malarials. At that point, if we had, people and we had patients, I mean family members rather, who knew what Lassa fever usually would come with, at that point, perhaps what we'll be dealing with would be better. And immediately it could have been, I mean, the referral could have been better. So thank you very much for that, Mary. Right, I want someone else to tell me what could have been done differently. I already mentioned it in passing. I mean, look at the entire storyline. What is that one thing that you think could have been done differently and could have changed the game? I want like a volunteer, anyone, please. From your own assessment of the situation, what do you think could have been done differently? All right. I think just let me check the participant list. All right. Okay. Akinpelumi, I think there's someone on the call. Akinpelumi, if you are on the call, what do you think could have been done differently? Like, looking at the storyline, what do you think if we had done this differently would probably have changed the game for us? Akinpelumi, can you?
Sorry, sir, I lost connection at some point.
Oh, okay. So that's fine, absolutely fine. So let's keep going. So, but the point is, just like Mary told us, at that point, if family members knew better, if they had the understanding and they are better equipped with better knowledge of what the symptoms of Lassa fever, are, perhaps they would have, suspected and would have referred appropriately. So because of our time, I would move very fast. Next slide, please. So I'm hoping that by the time we're done with this lecture, we're able to understand why we have a persistent Lassa fever infection in Nigeria. And of course, we're able to look at some of the weak links in our systems, in our health systems, that have actually contributed to an escalated situation of Lassa fever infection in the country. And also, we're also going to talk about some of the ways we can strengthen Nigeria's response to Lassa fever infection. Next slide, please. So, as a way of introduction, I would say Lassa fever, as some of us may know, is a viral hemorrhagic illness, of course, that is very endemic in West Africa. And of course, we identified it first in Nigeria over many decades ago, about 1969. I think that was when, the first case was identified. And, when we talk about Lassa fever, the primary reservoir of that infection is a type of rat that is called multi-mammoth rat. So, I was going to put a picture of that rat. When you look at that rat, ideally, when you look at the belly of that rat, you would see there are a lot of breasts there. So it's called multi-mammoth. So there are a lot of breasts on that rat. So that way you're able to identify that rat. So, and of course, this is usually the kind of rat that gives that infection, right? So, of course, and also, apart from the fact that we can get that infection from, this particular rat, when I say rat, anyways, not necessarily when the rat comes in contact with you. Of course, it could even be when the rat, urinates or puts or infects whatever food stuff you've got in the house, maybe your food, your gari, your rice, any of those things. Once those rats kind of have contact with them and they deposit maybe any of their remains on those foods and you get to take them, you can get infected by Lassa fever. And apart from this animal to human infection, there's also the human to human kind of infection, we call it person to person transmission. And this is usually common amongst among people, especially healthcare workers, because usually when you're dealing with a case of Lassa fever and diagnosis has not been made, and the index of suspicion, if it is not high enough, and probably some would even think you're dealing with something else. So at those points, if the necessary precautions are not taken, you could easily get infected that way. So this is one of the ways where we have the human to human transmission. And of course, there has been a whole lot of situations where fatality would usually result from infection. And from statistics, we've had, global statistics, about 1% or thereabouts have been hospitalized. Lead to fatality, and about 15% or higher end up being hospitalized. So what is very important to also note that apart from detection, early supportive care usually would improve survival. And of course, in fact, it can actually be the game changer in all of this. Next slide, please. So I would want to say that it's very important for us to note when to suspect Lassa fever. just like the case of the pregnant woman I highlighted at the beginning of this presentation, we must understand that when we have fever that is not responding to antimalarials, I mean, after about 48 to 72 hours, you've used antimalarials for 2 to 3 days, but there seems to be no improvement, then you should be wary of what could be going on. And especially if by the time you're clerking, maybe as a doctor, you're interacting with your patient, and your patient is giving you an history that there was a recent exposure to rodents, or involving areas or the individual, the patient is had worked or lived in a place where rodents live or they come around, then your index of suspicion should be heightened at that point, of course. Or if the patient is telling you that they've bled at some point and you can't seem to fathom what could have led to that bleeding, so then you should start suspecting the facial swelling or weakness, vomiting. All of these things are symptoms of Lassa fever infection. And of course, health workers with compatible symptoms, we must understand this. And of course, if at any point in time you had seen a patient and you realize that after seeing a patient as a health worker, you're developing some of these symptoms, then it should bother you. You should be very concerned. And I should suspect that you might be dealing with a case of Lassa fever. What do we do at this point in time? Then the first thing you must understand is that you isolate. Is very key, because if you do not isolate at this point, you would not just put yourself at risk, but you also put other people at risk, your family members and those also caring for you. So whenever this is the case, you isolate, right? And you call for help, right? And in our system here, there are some of the problems we are dealing with. But of course, ideally, of course, they are actually toll lines, but the question is how readily reachable are these lines? Because this is one of the things we are going to be talking about today. So, but ideally, what you're supposed to do at that point will be to notify a disease surveillance officer who would come and say, "Oh, look, there's something. These are the things you've reported," and will take you to necessary, primary health care, where the proper, of course, transportation in itself would have even been properly done, right? And of course, you are isolated, and the necessary supportive care and definitive treatment, is given out. Next slide, please. All right, so I was just going to just sort of give us an overview of what the transmission cycle is like. And of course, from the standpoint of a healthcare worker or someone who is working to address the issues of Lassa fever infection, where to interrupt any of this the flow of transmission. So I started with talking about the reservoir. I already talked about the mastomes. These are the multi-mammate rats. So they are the reservoirs of this infection. And of course, I mentioned earlier that from there, when they get in contact, they contaminate our foods, our household items, and of course, human beings, when they interact with any of this contaminated stuff, then the human infection begins. And of course, usually, more often than not, we realize that this infection gets to healthcare workers. I mean, those who are even caring for patients, right from those who have been, infected. And I had to, put some bullet points for us to appreciate how we could interrupt this flow, right? How we can interrupt this flow. And I said that, rodent proofing and, safe storage. Well, at the time, people just put, food stuff. Some don't even have lids on to cover wherever they have kept their food stuff. This is something we need to be very particular about. I mean, this is more like raising awareness to us as individuals, because apart from the fact that we're telling government needs to step up surveillance, government needs to do this and that, but from our own standpoint, we want to leave this session and go back into your kitchen or wherever you keep your food stuff and try to see, are you actually properly storing your food, or are you keeping them where you can easily have rodents around? And if you live in that environment where rodents exist in their numbers, you probably want to look for rodenticides and things to ensure you take them far away from where you live. So these are things we must take note of. And of course, when it gets to a point where the risk are there, then you will need to communicate. And of course, early care seeking. We're not just saying, oh, you took malaria for an infection that came. You knew that anti-malaria, you had been on anti-malaria for like 2-3 days, and there seems to be no resolution. And some of the symptoms I had mentioned earlier begin to set in, then it should be very wary, and it should bother you that what you're dealing with definitely is stronger than malaria, if I may put that way. And of course, when you can confirm that there's an infection, I mean, this may not be you now, but at the primary health care level, at the secondary care level, wherever the patient has presented, it's very important that there has to be rapid testing. I mean, this is one of the problems we are facing with testing. Usually can be delayed. Look at the example I gave earlier, where the patient, was not, tested on time. And even at the point when we can suspect that what we are dealing with here is more than malaria, then we need to start putting everyone who had interacted with the patient, who had contact with that patient, on alert that they need to, at least for that moment, isolate until we get to ascertain that truly this is either Lassa fever or not. So these are some of the things we must, how we can interrupt, this flow, this transmission cycle of Lassa fever. And of course, more importantly for healthcare workers, I mean, this is something that has always been in discussion for a long time. And this is also one of where policy and, requests for systems change coming. Many healthcare workers, try to attend to patients without protecting themselves adequately. So this is not supposed to be. And of course, if that is not done properly and properly triaging patient, you don't just clumps patient. The patient is coming and you suspect it's acute hemorrhagic fever. You still putting that same patient with the patient who is just probably presenting with maybe traumatic patients, put cramping everything. It's definitely not going to help. So yeah, next slide, please. All right. So I just thought to also highlight, since we are dealing with how to strengthen Nigeria's response, to highlight some of the situation at the moment in Nigeria. So as of this early this year, right, we've had several infections. So, and of course, there has been several cases. In 2025, just last year, we had several cases of fatality, several cases, about over hundreds of deaths as a result of Lassa fever. And let me quickly also mention that usually we get to experience Lassa fever cases, or we get to see more of Lassa fever cases, usually around towards the end of the year, November, December, January, February, till about April. I mean, data has shown that this period, we get to see influx of patients who report, case of infection, of Lassa fever infection. So yeah, but last year we had over 100 deaths. I mean, over 100 deaths, and of course, fatality rate was about 18%. Just imagine if we are saying we had recorded over 100 deaths, that means we had like more than 2,000 cases reported. I mean, cases of infection last year. So and this shows the persistent reports of Lassa fever infection in Nigeria. And as of this year, as of January, late January, Nigeria already recorded about 160 confirmed cases of Lassa fever. And of course, unfortunately, we've had about 30 deaths just in between January and February. I mean, just January and the first 2 weeks of February. This is what the Nigeria Center for Disease Control and Prevention have said in their data. And of course, unfortunately, I did mention earlier that health workers are also not protected. They are not protected actually. They're not immune to this infection. So we've had cases of about 15 cases of healthcare workers who have been infected, and unfortunately, 2 have been, two fatal cases have been reported. So as at February 16, when the last report came out. So I'm saying that it's very important. And I keep emphasizing this, because many times the expectation would be as healthcare workers that you can always just do things. I'm sorry, like being patriotic is very important, but of course, if you don't protect yourself so that you can save lives, of course, there will be very little people who will be alive to save those lives. So it's important that you protect yourself adequately. In systems where these things are not available, it's important to emphasize the request for them. You don't get to see a patient bleeding, fever, and you just go ahead. It's very important. And of course, some of these cases have been reported in Ondo State, Edo State, Bauchi, Taraba, Ebonyi, and Benue. And of course, with some specific local governments as hotbeds for these infections. Next slide, please. All right, so at the moment, according to the NCDC, and of course, what we see in our centers, the current structure of response that exists as of today would be that, of course, that when cases are detected, it should be reported, right? And of course, contact tracing is said to be done. And, when these suspected cases are reported, then the patients are tested, right? And samples are taken to, the labs, where we now have to wait, for the results to come and to confirm or to disprove or to say, oh, this person is not infected. And of course, then usually in many cases, when patients come in and these symptoms are there, currently the advisory would be to start the patient on supportive care, right? And in situations whereby the patient is in a particular clinic where such clinic is not equipped enough to respond, then patient is supposed to be referred to a center that would treat. And of course, at the moment, triaging is very emphasized in our hospitals. And of course, safe care, I already mentioned protective personal equipment. It's very key. These are some of the things that have been emphasized. But next slide, I want us to look at some of the weak points that exist. I mean, from my study of what we currently have at the time, one could easily picture some of the concerns that have been picked up, right? So just like the scenario I gave us the first time, the truth is that it could come off as though this is a case. I mean, it could come up to many of us, and we could easily say this is an hypothetical scenario, but it isn't. It's not an hypothetical scenario. It is just an example of what is existent today in our communities. So one of the problems we have found out at the community level is the late case seeking behavior of patients. Many people don't care, and this is one of the problems. And if any awareness needs to go out, I know the NCDC is utilizing several media platforms to tell people about Lassa fever infection, but there's a need to go to the grassroots, because the truth is, if we are just relying on just Twitter, the question is how many Nigerians are actually on Twitter? We're using social media. Beautiful. In fact, there's a lot of publicity also going on television and radio. So, but of course, beyond those who have access, I mean, I'm wondering, I think it's only those who have access to constant electricity supply that would probably listen or tune into radio or would tune into television. But there's a need to go to the grassroots level. And even PHCs should work with community mobilizers to ensure that people at the grassroots are well educated about what Lassa fever is, especially in states where the burden or the risk are high. So this is one of the weak systems we have identified. People seek care lately. They seek care late because they feel what they are dealing with is probably malaria or whatever. So, and of course, unfortunately, many people, because they don't understand what they are dealing with, they resort to self-medication. So at the primary health care level, the suspicion index is very low. I mean, low index of suspicion. I mean, I told us about this particular case I mentioned earlier, where the pregnant woman came into the primary health care, and the next thing was to also start the patient on anti-malarials or being treated for malaria again. It shouldn't have been the case. I mean, ideally, when the patient comes in and you already have your history, there are some positives to indicate that we are dealing with Lassa fever. The next thing would be to ensure rapid testing for that patient, or you refer appropriately where the need is. And of course, sometimes the delay in transportation, because it isn't just the usual kind of transportation. And I think it's at this point I also need to emphasize one of the problems we are dealing with. There's no standardized or appropriate measure of transportation that is ideal for a suspected case of Lassa fever. I can imagine someone who lives in let's say Akufo in Ibadan here, and you are trying to transport someone who is suspected of Lassa fever, and you still tell the same person to move into Mikra with other patients before the person can get to the nearest place to seek care. These are some of the issues we are dealing with at the moment. And of course, I already mentioned, when you get to many of our hospitals, in fact, secondary care centers, tertiary care centers, when you look at the triage, I mean, the accident and emergencies, when you look at how crowded these places are, you just fear for the fact that you hope that no patient with Lassa fever comes into that point, because it is very, very unlikely that if a patient who is suspected to have a Lassa fever comes in, and because of the crowded nature of this many times, those emergency points, I mean, everyone there is very, very at, great risk. So these are some of the, cases where we're dealing with. And of course, our labs and results, the slow turnaround. I mentioned something earlier that we take samples and we have to still get to some specific clinics for those samples to be tested to be sure that are we dealing with a case of Lassa fever. The turnaround time is always very low. So these are some of the issues. I would expect that every state in Nigeria, in fact, at every state, there should be like several testing points. It should be easily accessible such that when we see cases and we suspect this is Lassa fever, then this should be done. And sometimes even the specimen we are taking, the specimens are not properly also taken. So these are some of the weak points that I identified. I've identified that are currently existent in the Nigerian system. The gaps in the infection prevention and control system. So next slide, please. All right, so there are 4 major pillars that I'll be discussing with us in a very short period of time I have left for us to see how we can indeed strengthen the Nigeria's Lassa fever response. The first I'll be talking about is early detection. Then I would talk about faster diagnosis, infection prevention and control, and community engagement. I already talked about some of these things while since I started, but I'm going to, delve a little bit further into each of them so that we can get to understand where we need to do better, right, as a country. I mean, not just healthcare workers, even as an individual. While we create that awareness, we need to let people know that this is where you come in, because surveillance is actually not the responsibility of government alone. We need to emphasize this, because many people think that it is just government that needs to do this, but we need to let the community understand this is your own role. And of course, when the community understands their own role as a healthcare worker, you also know what you're supposed to do. Then, of course, policymakers, there are certain things we need to do when it concerns the health systems. And government, we all have shared responsibilities to ensure that Lassa fever do not just keep taking people down in Nigeria. So next slide, please. All right, so early detection. The goal here is to reduce symptoms, onset, suspicion, and ensure test is being done and isolation done immediately. So now, what do we do to strengthen our early detection measure? So the first thing, like I said, is that when there are room, because again, many things happen within a community. In fact, when a community has been sensitized or has been, awareness has happened in a community, there are situations whereby it could come as rumor. This woman who sells something here, she's been vomiting blood and everything. But unfortunately, when the system whereby many people, because of stigmatization, they feel like, it must not be heard. The mommy something, mommy what, mommy this is, suffering from whatever strange illness, as people would, deem it. So in situations like this, when there are rumors, there's a need for community surveillance to happen, and there has to be a verification of such rumor, right? And of course, when there is a clear Lassa fever case at hand that we are dealing with, then PHCs, primary healthcare centers and private clinics. Because again, I think I need to also point this out. Usually at the primary healthcare level, where we're advocating, much of our advocacies have always gone towards this. But again, there's a need to also educate private clinics, especially those that are not equipped to respond, to understand how to, take patients and refer appropriately. This is one of the things we need to emphasize, because most of the focus has always been on public facilities, public clinics. We need to also talk about private clinics, because many private clinics will just feel like, I will just keep the patient and think that they can make more money, by trying to offer some strange cares for those patients. So this is one thing to look out for. And of course, notifying whoever the disease surveillance officer has to be notified on time, so that they can quickly start contact tracing and follow up and ensure that that suspected case is being diagnosed properly. Specimen are taken and of course sent to the lab for proper case. And of course, I really would like to also say kudos to the NCDC. Our systems are not the way they used to be very fair and honest. But of course, there's still more that needs to be done. There has to be a decentralization of data collection and review. We don't have to wait until when the NCDC comes and say, NCDC and says every week, this epidemiological week, we are now starting to talk about what is happening in the whole of Nigeria. Look at what happened during COVID-19. It was very brilliant. The states had their own task forces, and they had to set up a weekly review of what was going on in each of those states. What stops us from, having that kind of system? Is it because we would say that because we have not had enough cases? How many deaths is too much for us to start responding appropriately? Every state should unlock their surveillance system, and of course, there has to be a review on daily basis. Or your state, every week, if there is no case, tell us there is no case, and everybody should be aware. And this would also not just create awareness, it puts in constant reminder that everyone's seeing or hearing that this case is still in existence. So that is very key. And I have to highlight how to do it at some points. Of course, when we also get to our clinics, it's important for us to already even have a checklist, because again, many times our systems are very overwhelmed, and health workers at times can be very lost in caring for too many people. And this is not an excuse for poor diagnosis, but I'm just saying it would be very helpful for healthcare workers to have a checklist. The patient comes in, you look at the checklist: fever, body weakness, vomiting, bleeding. Once you tick certain number, the checklist, and you see this is what we are dealing with, then you refer and you do the necessary, necessary things. So it's very, very important. And also, isn't just saying, oh, we have to refer patients. Where do we refer these patients to? Who is taking responsibility? We have seen cases whereby, oh, I don't have money. We are waiting for the disease surveillance officer to come around and ensure the proper transport. And you keep waiting for disease surveillance officer for about 2-3 days while the patient is dying slowly. These are some of the things we need to look into. And this is where our systems need to do better. I mean, there should be a proper calling. If it wouldn't tinkle overnight, call and tell someone to come in and check and refer. And of course, we're not just waiting, because another thing is this, we talked about PHC level, local government level, state level, because if we are waiting for someone, a case has been reported in Shaki, for instance, and we are waiting for the DSNO to come from Ibadan first to Shaki. At every local government, there should be an arrangement at a time like this to ensure that every case gets the deserved attention and the necessary referral as it should be. Now, I will ask us, ideally, what do we think should be an average time to get a test result? I mean, if I were to ask any of you, like you are in the place to make that law and policy, what do you think, or if you had the powers to ensure things are done rightly, what do you think, what's an average time to get a test results? I mean, because of our time, I'm not going to call anybody, but just think about it. Next slide, please. Okay. I think you're right. And is raised.
Yes, sir. I will say that within an hour max.
Wow. That's very impressive. And I'm really hopeful we get there. We really get there. Thank you very much for your response. Next slide, please. Okay, thank you. So I'm going to talk about the second pillar. I'm going to talk about faster diagnosis, right? There is a need to diagnose very fast. Akipington already said, I mean, we should get to that point when results, the turnaround time is very, very short. It needs to be very short because the point is there's a chain and there's the contact tracing that needs to happen. So, and I mean, I like to use the example of COVID-19 for many people because I think it brings it home for many of us, because I think that was when we saw our government at work the most when it comes to healthcare. And I mean, I think our healthcare system is better for it. But I'm just trying to say that, the turnaround period needs to be very, very high. And I already talked about the fact that there has to be decentralized access. I don't have to wait. A case has been reported in Ogbomoso. I don't have to wait for an officer coming from Ibadan who would say that there's no transport money, there is no, all sorts. So this has to be decentralized. At the least, every local government should have a system of proper referral, and if at possible, we should have our test being done in every local government. I know it looks like a far-reaching recommendation, but it is very doable if we prioritize and value the lives of Nigerians. So, of course, specimen transport, it has to be transparent safe, because in a situation whereby we're saying, okay, fine, we only have a few testing centers, we need to transport like safely to places. You're not just going to wrap a specimen inside one a nylon and you send it to a bus coming from Ogbomoso to Ibadan, and on the way the bus driver drive, all sorts of things happen here, and it's very shameful. But of course, these are things we need to look back into. Right? Set targets. We're sending this out now. We're receiving a result this social time, and all of it helps the system to, be trusted in a lot of ways. And of course, once these things are already there, we don't even need to wait for this result to come out before patient is placed on supportive care to to increase the chances of survival. This is very, very key. And of course, in all of this, I keep mentioning, we must keep healthcare workers safe. It is very key. Next slide, please. All right. Thank you very much. I think Pelumi did mention what I had in mind. When I was preparing this, I thought about it. What could actually be a good turnaround time? We can have our results within 24 to 48 hours, at the max 48 hours. Like, it's doable. It would help. And of course, we don't have to call multiple times for the DSNO. So before the DSNO comes, like, it has to be very rapid. And this line should also be toll free. Of course, I mean, it's been said it's toll free, but the issue is how many people get to, have access to this. So again, it's very important. And of course, from my own assessment and look, what good would look like when we are talking about faster diagnosis would be quick call, and facility reaches out to those who are going to refer and transfer, and they are there, right? No health worker infections, because of course everyone has what they need to, protect themselves. Specimen are properly packaged and transported, and waste disposed properly. These are things that are not far-reaching. They are things that we can do, but it's just that we must emphasize this. And this should not just be happening. Again, I keep emphasizing this. In Oyo State, we should not be seeing all of the good things happening only in Ibadan. I should be able to get to Ibarapa and see that we are having the standard form of care happening. Next slide, please. All right, infection prevention and control. I already talked about some of these things. Because of my time, I'm going to really move very fast. We triage at the point of entry, ensure that there's proper separation. You don't mix people who are reporting acute hemorrhagic fever with someone who has a broken leg as a result of motorcycle road traffic accident. It doesn't make sense. So these are things we need to do. And of course, standard protection, PPE. I can't overemphasize it. It has to be available, and not just bringing some protective equipment that you bring it for bringing sake. Like, for instance, we are wearing gloves. A nurse who is wearing gloves that is oversized, and the hand is so small. When you insert a small hand into a very big glove, is a larger size of glove, you see it's so loose, and whatever it is you are doing, there's a chance that whatever it is can actually get seeped into that glove. And we've seen cases whereby we only have very small size gloves, and whoever is wearing has a very big palm, and you wear it, easily gets torn whenever you're trying to maneuver anything. So these are things we must consider. We're not just saying, okay, just give them anything that is available. Proper PPE availability and fit is very key. And hygiene and environmental clean is very, very key, both for patients, both for, the community, and also for healthcare workers. At every point in time, the advocacy, the NCDC would say, wash your hand when you are seeing a patient, before you see that patient, and after you see that patient. And of course, in a situation whereby your hand is not visibly soiled, you use what? Hand sanitizer, alcohol-based hand sanitizer. These are things. And of course, most important, there has to be constant training. We don't have to wait until when Lassa Fever starts spreading everywhere. By now, every state government, every state in fact, not just government, because I need to also mention it, every health or clinic in your own facility, in your primary health care center, there should be a training happening. It's not until you wait until a case is reported. We already know between November and April, we have a surge in the reporting and the cases reported. So before that period, maybe September, start training workers, educating workers on how to handle cases. This is how things needs to be done. Because of our time, I won't ask this question, because I was going to ask, what infection prevention and control step falls most often? Is it the triage? Is it the protective equipment that are not usually available? Personal protective equipment? Is it the isolation? Is it how we do our waste system, how we manage waste? Or we don't even have enough healthcare workers to respond to situations? Next slide, please. All right, the last pillar that I'm going to talk about, because of our time, is community engagement and One Health prevention. I know we relegate the issue of One Health in this part of the world these days, but we must get to that point. We must get to that point. Of course, I already talked about going right to the community, educating the community on how to properly handle and store safe storage of their grains, of their foodstuff. What are those food items that rodents would naturally be attracted to. How do you store them? These are things that should be at the top of our, awareness to the community on Lassa fever and all of this. So yeah, and also how to properly dispose waste. Risk communication. We don't have to give bogus information to people. Simple messaging, like tell people, of course, you have fever, it's not improving. Seek care. Don't wait until you keep using analgesics. Some people, fever, today, tomorrow, next tomorrow, keep loading paracetamol. They keep taking all sorts. And the situation is not improving. And they don't know that the next thing to do would be to seek proper care. So these are things we must embed in our messaging to our community. And of course, those who are also giving care at home, they are during that period we're isolating, they also have to protect themselves. This cannot be also over-exercised. There's a need if the family members, maybe the wife, the pregnant woman in this case, the husband who is trying to also help and everything, protect yourself is very key. All right, so I would also like to emphasize again, One Health coordination is very important. I know, we don't get to talk about it because we feel it's not important. Responding to Lassa fever in Nigeria is not just the work of doctors, nurses, dietitians, pharmacists, and all of those healthcare workers alone. There's a need for environmentalists, agriculturists, veterinary doctors, people who are actually involved in the whole complex web of care when it comes to Lassa fever, and of course, right from its reservoir, those who can actually help to prevent rodents from also invading our spaces. Checking rodent ecology, you get to understand, okay, this is where we have more of these rodents, and we're able to deal with this situation right more at this point in time. So these are some of the things I already talked about. There are seasonal periods that we have peak cases happening. So target those moments. They get to evaluate, climate scientists get to, predict these are the things, and, we respond properly. I'm just saying that for us to strengthen Nigeria's response is not just the work of healthcare workers alone. We have our ecologists coming in, agriculturists, environmentalists, and everyone. Everyone's hand needs to be on deck for us to respond appropriately. Next slide, please. Next slide, please. Next slide. Can you hear me, please? All right, so I will just say, I think the slide is not moving. So, but I'll just say from here that it's very important to prioritize all of these things. And also ensure that things are being done the way they should. Dr. Ala, can you hear me? Can anyone still hear me? I need to confirm if it's not being stopped from my own end.
Yes, I can hear you.
All right, thank you very much, Mary. So yeah, I think I need to wrap up at this point because of my time. I'll just say some of the key takeaways from this session would be that the next outbreak is not a question. It's something we've been seeing year in, year out. We see it every now and then, right? So it's important for us to note that we're going to have another Lassa fever outbreak. God forbid, yes, we're religious people, but the chances that would have a next one happening is very high. So the question is, are we going to be ready by that time? So Lassa fever is a system test. It will test our system, but of course we would respond because we are prepared. And of course, our structures need to be well coordinated for us to respond appropriately. And of course, like I mentioned, I emphasized about 4 pillars that I think we need to take cognizance of, which is early detection has to be heightened. Next slide, please. Early detection, of course, and faster diagnosis plus care. Then our infection protection control, and of course, community and One Health prevention is very, very key. So yeah, these are things I want us to take away from this session. Thank you very much for your attention. I'll stop now and take questions. Thank you very much.
Adetula for the session. It was very engaging. I'm aware I got lost at some points. It was due to my connection. I apologize for the break in transmission. So just like everyone that's just like me and everyone that has been on this call, I'm sure we benefited a lot from this session. We had a number of questions before this session, but because of our time, we will not be able to take everything. So I'll only be reading out just a few of them to you. At least we'll take one or two questions. Other ones, if you have more questions from the session, you can ask in the comment section on our social media pages. You can just tag the flyers to this event, and then you have your answer. You can also send us a direct message on Instagram, on Twitter, on LinkedIn. You can even send us a mail at admin@healthfacts.ng. We'll provide answers to your questions. So, but for the purpose of this meeting, we'll just ask two questions, and largely related to the presentation this evening. So first of all, well, some of the questions here, we have the answers already in the slide. So just in case I do not ask your question, I'll urge you to go over the presentation again, you will get your answers. So, but the first question I have here, can children contract Lassa fever?
Yes, children are not exempted from, contracting Lassa fever. I already explained earlier that we have the animal to human transmission, right? We also have the human to human transmission. So as long as that, children, have contact either with infected or contaminated stuff, right, or from human beings, of course, children are very susceptible. And we should also know that children, especially for very, very young ones, their immune system, they also at the extreme of ages. Children and very older people, their immune system are not so strong. So yes, they are in fact great risk of infection if they are
Thank you
exposed.
very much for your response. So the last question I'll ask here is, can Lassa fever be transmitted through breast milk?
Okay.
Did you get my question?
The thing is, I did. Are you still
Dr.
talking?
Adetula, are you still with me?
Yeah, I'm with you. Can you hear me? I'm talking. Yes, I did.
Oh,
I did. Sorry, to be sure,
yeah.
You asked if Lassa fever could be transmitted through breast milk. Was that your question?
Yes, that's my question.
Correct. Yes, so we've had some literatures reported that Lassa fever have been, detected in breast milk. So it's very possible. For instance, especially, patients, if a breastfeeding mother is infected with Lassa fever, there's a high risk of transmission, vertical transmission. Transmission from from the mother to the child is very possible. It's very, very possible. So yeah, right. We have seen, of course, maybe not so common, but it's very possible.
Yes. Thank you very much, sir, for your response. So I would just like to reemphasize some messages that Dr. Adetula tried to share in his presentation, and one of which is to health workers that you should pay attention to protecting yourself, wear personal protective equipment. Earlier this month, or this last month, we heard of the news of a medical doctor at Bingham University who died from Lassa fever infection. So it is very possible for healthcare workers to be affected as well. So please take care of yourself, look out for one another out there. And to individuals, they call, when you see the topic, you would think that it will be largely addressed to organizations, the government. But then one thing you should take home is that you can do a lot by, as a way to strengthen the Nigeria's response to Lassa fever infection, one of which is to take care of your food, keep your food in safe places, have rodent-proof areas where you keep your food. And another way, when you see symptoms that are looking funny, they are looking too much. I mean, if you have a neighbor that is coughing blood, or even if it's not that excessive, you try to treat malaria for some days and you're not getting better, or you've been treated for any common infection and you don't think you're getting better, I'd like to report to the hospital so you have proper care. So the importance of the things that we can do as individuals cannot be overemphasized. It's going a long way in ensuring that we live healthy and have a safe community for all. Thank you very much, Dr. Adetula, once again. It was a pleasure having you in this meeting. I've learned a lot, and I'm sure everyone that will get to listen to this recording of this session would learn again. I'd like to enjoin everyone that's on this call, those that will hear, that will listen and watch the recording much later, to subscribe to the HealthFacts video service and access it by visiting portal.healthfacts.ng. The videos there are created just for you, the Nigerian audience, and you gain maximally from them. You can visit our social media pages, HealthFacts Nigeria, HealthFacts NG on YouTube and on Instagram as well. So thank you once again for your attention. It's been a pleasure having you all. Thank you, Dr. Adetula, once again. Thank you to every member of the audience, and I wish you a very nice time, and till meet again another month. Bye for now.
Thank you very much, everyone. Thank you for having me, Dr. Ala, and everyone. Thank you.